Hi, I'm Dr. Keerthana, obstetrician and gynecologist, Shourya Hospital, KPHB. Today, I'm going to give some information regarding HPV vaccination. HPV vaccination is nothing but human papilloma virus vaccination, which is usually protected against HPV virus related malignancies like cervical, vulval, vaginal, oral, and in males it is like penile carcinomas and some infections like warts. Actually, in India, every yearly nearly 2 lakhs of newly diagnosed cases of cervical cancers and 77,000 of nearly deaths are occurring. To prevent this, HPV vaccination plays a main role. Nearly 150 type of virus variants are diagnosed. Among them, 20 to 30% are very dangerous to the human health. When the women who are exposed to this type of various viruses, which is lead to the malignancies. There are two type of vaccines are available. Among them, quadrivalent vaccine, which is usual to protect it against the 4 type of variants, and again 9 nanovalent is there. It is usually protect against the 9 type of variants. The dosages is which is usually for girls, it is usually started from the 9 years to 15 years of age with the dosages of 0 and 6 months, which is if the dose which is given today and the second dose which is repeated again after 6 months. Even boys also same, like 9 to 15 years, and it will prolonged up to 21 years. For girls, it is up to 9 to 45 years, and after 15 years, the dosages, it is like 3 doses, 0, 2 and 6. First dose will be given today and second dose will be repeated after 2 months and third dose will be repeated after 6 months. Increasing the burden of cervical cancer, HPV vaccine, which is preventing from cervical cancer. And second most important thing is screening. Screening is also plays important role. There are 2 types of screens which is usually available in India. There are pap smear and HPV DNA test. Among them, pap smear is very simple test which is usual to collect the discharge from the cervix and we send the histopathology report. Along this, we will be follow up the case. Pap smear we will be reported every 3 years, and along with pap smear and the HPV DNA test, it will be repeated every 5 years. HPV vaccination can be taken any time of the day and any day. It is not related to the periods. In India, actually HPV vaccination is usually less than 1% of the total population. When it is increased up to 90% and the screening increased up to 70% and treatment will be increased up to 70%, the burden will be decreased in India. Don't let cervical cancer stop you. Get screened and vaccinated.